Hey everybody, I'm Dr. John Meis with the Spark Dental Network, and I'm here with Dr. Jason Howell. Dr. Howell has a lot of experience in group practices and DSOs. Was a clinician and doctor mentor in 2 very large DSOs. Also helped develop a program to develop young doctors for one of them. And he has a lot of practice experience, clinical experience. Worked in a startup, worked in a single doctor office, multi-doctor office, has moved from office to office, changing the results, improving the results every place he goes. So he's a wealth of experience and a wealth of knowledge, and welcome. I'm glad you're here, Jason.
Thanks, John. Good to be here.
Yeah, so we're going to talk about the challenges that happen sometimes between clinicians and management, and different ways that we found to effectively manage those. So one of the things that we see is conversations with doctors that go something like this. I'm not getting paid enough, so I want to change the way I get paid, right? Go ahead.
No, we hear it very often. You're exactly right.
So most doctors are paid on a percentage of collections, right? And often the way they want to change how they're getting paid is to increase their percentage, right? That's the most common solution that they suggest.
Can I increase my percentage but not do any more dentistry?
Right.
Yeah, that's what I want.
Yeah. And, so from a management standpoint, what we want to do is we want to roll our eyes and we want to say, well, let's just get to work treating some more patients, and you learn all you want to, right? That's what we want to say. Yeah. But we can't let what we want to say interfere with what we want to accomplish. Right?
That's exactly
So when I hear this statement, my response is always exactly the same. It's always, oh, you'd like to earn more. And when they have some affirmative response, I say, well, great, I want you to earn more too. Let's figure out how to do it. Right? And so what you do is you're not creating a separate, you're not drawing a line in the sand. You want to say, oh yeah, we signed a contract and that contract's valid and you're not going to get paid any, you want to say all those things, but they end up having you be on 2 sides of an issue. And I'd rather step over whatever line is there. I want to step over it and get on their side and talk about how we can have them earn more.
Right.
Well,
that's a great way to put it, because ultimately the statement that we're looking at, it's not saying that I don't want to do more work or I want to see less patients. What it's really saying is, I'd like to earn more. How can you help me?
Yeah.
And we as leaders, it's our job to say, fantastic, we want you to earn more too.
Yeah.
These are some ways that I see that could help you achieve the goal that both you and I want.
Yeah. So, when I was a kid and I would ask my parents for something, one or the other of them would say something to the effect of, do you think money grows on trees? Right? And it's kind of our natural reaction to come back with something, maybe too assertive and creating conflict that doesn't need to be there.
Yeah.
And
so your parents said that too?
Oh, absolutely.
Yeah. Mine must have went to the same school as yours, because I heard that numerous times.
Yeah. So what we want to talk about today is what we found the fastest way to help doctors get to that place where they're earning more, right? And the fastest way that we found to get people to earn more is to help getting more patients to say yes.
Yeah, this is a great topic to be looking at, especially in today's day and age. But the quickest way that we see, and for me as well, is you're going to earn more is when you're going to produce more and you're going to see more patients. And every patient you see tends to have more treatment plan acceptance. So what we like to call it is, how do we get patients to say yes?
Yeah. And so what you just said, every manager knows that. Right? They know it in their being, because they think like a business person and they think in numbers. And I've been just very, very surprised, and I continue to be surprised, that many dentists just don't think that way, right? Yeah. They think about their profession, they think about their craft, they think about their quality of treatment, and they don't necessarily connect the dots on earning more.
Yeah.
So one of the things I always want to start out with is, you want to earn more, how much do you want to earn? Right. Try to get a number from them, because that allows you to back up and go through the metrics with them in the math.
That's a great point. So I want to earn more. Well, how much more do you want to earn?
Yeah.
Is it 10%? Is it 20%? Is it 50%? Where would you like to be? Because we need to always be able to come back and say, this is where we are. how do we reach where we want to be?
Yeah.
And, you know, what we like to coach, or I like to teach is a lot of times, you know, if it's 10% more, 15% more, those are very achievable.
Absolutely.
And this is very achievable without really doing much different than what you're doing already.
Yep.
And what it comes down to a lot of times is being more in tune with the patient, with what their wants, needs, and desires are, and simply presenting the treatment that they want, which sounds like an interesting concept, right? But, and then being open-minded and open and willing to just do some same-day treatment.
Yep.
Same-day treatment is one of the quickest, easiest ways to increase your production by 10 to 12 to 15%.
Yeah. Yeah.
Have you seen
Oh,
that?
yeah, absolutely a very, very easy way. And that's worth a whole other episode right there, same day.
Absolutely.
So if we focus on case acceptance and changing that, that really is somewhat of the first step of then getting same day clicking, right?
Right.
Is because you're getting more yeses at the chair, and now you've got more you've got more to work with as far as same day.
Sure.
And so when you get the clinician to really be open and honest with you with what they want, you know, and how much do they want to earn, and then you'll go backwards and figure out what the math is and show them the math. You know, this is where we have to get, you know, to earn that. So let's figure out how we do that. Now we are doing our job as support, right? We are helping them understand and helping them get in the right frame of mind. And now, when they're at that point where they see us trying to help them get what they want, right, it's a lot more receptive person to making maybe some modifications in some of the things they do.
Yeah, and I think it's important for us to be able to help them see really how achievable those goals are. And another thing that we can talk about as we get into this is with the team leaders and the office managers. I always encourage doctors, when we say we want to earn more, typically the more we want to earn more, the more we're upfront wondering why patients didn't schedule.
Yeah.
And so I always encourage doctors and team leaders as well. That is a great opportunity when we can ask the team leaders, what concerns did the patient have? Was there something information that I may have left out that could have got them to say yes and to move forward with treatment? So it's really, it's a team effort in regards to this, and we'll get a little bit more into how we get to this point, but I want to just make a point that the doctors have to be open and willing, one, to talk to us about, I'd like to earn more, and then two, talk to whoever's treatment planning and presenting cases is, what information did I maybe leave out? Was there something I could have done a little better to help that patient move forward?
Right. If we don't help our doctors understand this, and if we aren't seen as support helping them do that, they can be picked off, you know, by competitors, and there is a tremendous amount of that going on right now, where people are trying to pick off other people's providers, and by just promising them a little bit more in some way or another, maybe it's even just a signing bonus, a one-time payment, is enough to draw people away. So this is really a doctor retention strategy. And the reason why I wanted to talk to you about it is because I know your past. I know one of the offices that you worked in, one of the DSOs that you worked in, you were the #1 provider. You collected more than any other doctor in the company. You'd never say this because you're a humble guy, but I'm going to say it so that people understand the expertise that you have. Not only were you the #1, but the demographics of the area that you were serving was relatively low income. And you were doing a significant percentage of your patient population had Medicaid. Not that you were really a Medicaid office, but you'd had, you know, a significant amount of Medicaid in your office. And so for you to be #1 and be dealing with reimbursement rates that were so low tells me you've got this figured out. So I want to hear the magic, and then once we hear the magic, let's talk about how we as managers help our clinicians understand this and help them to move towards it.
Sure, yeah. So you're exactly right. What I found, and this didn't happen overnight, and it's a process, but what I found is that we can create a process, and it's repeatable. It's something that you can model. And for me, the biggest light bulb, so to speak, was when I was in that particular office, is it occurred to me that it didn't matter what insurance a patient had, it didn't matter what income level a patient had, but that all the patients we see have certain wants, needs, and desires. And so what I did with myself and my team is we made it a point to really find what that patient's wants, needs, and desires were. Every single new patient that came in, regardless of income or insurance. And then the second part of that is we got very, very diligent on every new patient that came in. We did the exact same thing. We took intraoral photos, we took full mouth x-rays, we perio charted, we treated every single patient regardless of insurance or not, the exact same way. And what that did is it allowed us to gather enough information to sit down and go over everything with the patient. And intraoral photos became such a key because we found that so many patients didn't really know or understand what was going on dental-wise in their life. And then we really did something completely different. We started focusing on specific areas of treatment for them. And we would use a formula, what we call PCS, which is problem, consequence, solution. And so I've always been a firm believer that we as dentists are so good at presenting a problem. We can tell a patient you need 4 fillings and 6 crowns. We can tell patients you have gum disease. But we're not that great at informing patients of what the consequence of that problem is. And what I found as we were talking with patients is that key little point, the consequence. The consequence will drive treatment. But the other point is we have to provide a solution. And nobody really, we would tell them a problem, you have cavities, and a solution, you need a crown. But we never, ever came to the consequence. And so a patient, what we found was patients, and I like to repeat this, patients don't need a solution for a problem they don't perceive to have. So that consequence would help them understand this is not just a problem, but there's going to be something that gets worse. And thank goodness, the good news is there's a solution for it today.
Yeah.
And
so let me stop you there.
Okay.
Let's put on our manager hat here,
All right.
right? And so if we're going to help to coach our clinicians about, the things that you already talked about, one of them is a commitment to a new patient standard. Right? That this is the standard, we're going to do it every time, everybody, unless a patient absolutely refuses, obviously. But that doesn't happen very often.
No.
One of the things that I see, and one of the things for us on development when we're doing mergers and acquisitions, one of the evaluations that we do of a practice is we look at their ratio of comp exams to limited exams. Right? So in some practice, a new patient is a limited exam, some minor treatment, come back for the full exam, right? So when I see that, I know this is a great opportunity, right? So what you're saying is, we're not having this limited comprehensive. We are doing the comprehensive unless we have a reason not to.
That's correct.
Right.
So every new patient that walks in our door is a comprehensive exam. Just like you said, unless there is a specific reason we cannot do it. And so in our practice, we have kind of an outline of the way we like to do things, and one of them is every new patient is a comprehensive exam. The limit is if they're in pain to the point that they can't sit and take a full mouth set of x-rays.
Yep.
So in pain or swollen to the point they can't open, we want to be respectful of the patient. But if they are okay and can sit through a full mouth set of x-rays, we'll take intraoral photos and x-rays on every single new patient. And what we like to talk to the patient is Dr. Howell's going to come in and take a good peek at you. We're definitely going to focus on the main concern you have today that brought you in. However, he'd like to gather as much information so he can make a good decision about the treatment you need.
Yeah. When you hear clinicians say, I can't get my patients refuse comprehensive exams, they're not refusing comprehensive exams. They're fearful that you're not going to deal with their primary concern.
That's exactly right.
Yeah, so you
right.
eliminate that fear so that they know that you're going to focus on what's most important to them.
Correct.
Yeah.
That's a
All
key
right.
point. Very
so as managers, we can help our practices develop their standard, and we see this as being really transformational for an office when they commit to those two things: comprehensive exams and gathering the same information on every single patient. That alone is probably in most practices 10%.
It'll transform your experience, your patient experience, but it'll transform the amount of dentistry you're doing immediately.
Yeah.
Because there's so much more dentistry that needs to be done that's just not being seen or diagnosed because we simply don't have the right information.
Right. And the second thing that you said, and I agree with it so much, and wish I understood it better when I was practicing, is that consequence piece. Everybody that we see has all kinds of things that they want to do with whatever resources they have. And they don't know really what importance to put on dentistry unless you describe the consequences of not treating whatever they have. And so that allows them to rank among their needs where dentistry really belongs. And if we don't share that with people, we're really robbing them of the ability to make a good decision. And I'm a firm believer that whatever patients decide, I have to live with and support that, and understand it. And even if I don't like it, I have to act like I like it, right?
Right. If we've given them enough information.
Exactly.
Exactly. And that, I will tell you, the two things you just mentioned, that every exam is a comp exam, and every comp exam we're going to do the same thing. And problem, consequence, solution are the two biggest things that changed my career overnight. And I'd like to relate it to myself too, is the more I understood problem, consequence, solution, it was amazing because I started realizing that a lot of the decisions I make in my daily life are based on the same problem, consequence, solution. And why we don't put that together with dentistry, I'm not sure. But as you talk to more patients and you explain the consequences, it's just amazing. I think we as dentists and we as the healthcare, we just think that the general public knows how dentistry works. And so we forget to tell them, but as you explain those consequences, there's so many times that patients will say, I just wish somebody would have explained that to me before.
Right.
And it's a light bulb goes off.
So as a manager, and you're trying to get people to talk in this problem, consequence, solution type of framework, I found that if you introduce the concept and people understand the concept and they go back to their offices, they continue to do exactly what they've always done. That just talking about it isn't enough. And so what I found to be more effective is if you sit them down and right now, this is a team meeting, and we're going to pick. You probably only need to know, maybe 10, 12 procedures, right? The most common procedures, and if everybody uses the same language, trust from the patient goes way up, understanding of the patient goes up. So we actually kind of script them out. Not that everybody's going to say it exactly the same way every time, but you want to get as close to that as you can without sounding like a bunch of robots. Right? So as a management team, we can help them by putting them in the context in which they have the time and the place for them to think through this.
Absolutely.
And so maybe it's at a weekly team meeting, you do one a week for 10 weeks and get it done. But it doesn't happen, in my experience, I just haven't seen it happen in practices just by introducing the concept, except for your star performers that are going to pick up everything.
You're exactly right. It doesn't happen overnight, and it takes diligence and effort, just like most good things do. And one thing that I suggest for a lot of team leaders is, just as you mentioned, having some team meetings, presenting the concept, and then each person writing down a few procedures and what are some consequences if you don't do anything, and helping them get it in their own words, their own verbs. And then what we always do is about one morning a week, we have our morning huddle, and about one morning a week we'll just flip up an x-ray or a picture and just point to somebody, PCS, and let them just go through what would be the problem, consequence, solution of that.
And it's
kind of fun. Yeah, it could be anybody.
This is a front desk person. This could be if the janitor happens to walk through.
Absolutely.
Everybody in the team. There's no reason for everybody
to know. It could
be
me. It could be anybody, right?
Sure.
And it's actually kind of fun because what's interesting is everybody has their own verbiage, and so you get to pick up key verbs, key phrase. But it's just a fun thing to do, and it keeps everybody on their toes.
Yeah. So creating space and time for people to do that is how management can support a practice. And then there's one other thing that in observing your practice that I saw that you did that was, I think, maybe a little unique from many practices, was that you would go over all the treatment that the patient needs, right? You would go over the consequence of not doing it. You would make all the problems visual, which is another thing I want to go back to. So making the problems visual, so people can see. Seeing's bleeding, right? So making whatever problem they have visual, then problem, consequence, solution. But then when you went to make financial arrangements and appoint the next time, you do something that's different than a lot of practices.
Yeah, we do what's called a focused treatment plan. And what we like to do is we make sure the patient's aware of all the treatment needed. We've looked at photos together. But I'm a firm believer in that that sometimes too much information makes things difficult, it complicates things. And so once the patient understands everything going on, we like to use different, word pictures and verbal cues, but I'll let the patient know. We'll come right back to what was their chief complaint, what was the number one thing that made them call in, if it was a limited exam. And if that's the case, we're going to present that area and we're going to focus and start on that today. If it's a patient that maybe they didn't have a chief complaint and they just came in because they needed a cleaning and needed an exam, what we'll usually do is, based on the photos, we'll say, why don't we start in this area? It's definitely the worst area, or usually I'll phrase, this is the first area that I see that may cause you pain or fracture or break or lose a tooth. But the key is that I always let the patient know that there's other work to do, but we're going to focus on this specific area. And when I have my treatment plan coordinators go over the plan, we present just what we call the next step treatment plan. And the next step may be today. Maybe we're going to convert it today and do same day treatment. It may be next week. But I always let the patient know we're going to go over our next step treatment plan and focus just on that. What we've found over time, and we've been doing the focus treatment plan now for almost 10 years, is that patients tend to get more treatment done in a shorter amount of time than when we used to do a full page treatment plan of every single thing that needs to be done. What I found was, no matter how many times you talked about what the next appointment was, once you went over the whole treatment plan, it was very difficult for the patient to not be so concerned or worried about treatment plan or appointment 4, 5, or 6. We always like to use the phrase in our practice is, we can't get to step 3, 4, or 5 if we never get to step 1. So let's get step 1 done and get this taken care of, and then we'll move as quickly or slowly as you may like to every other step. And our treatment plan coordinators are fantastic with that, but it made a huge difference in the amount of dentistry our patients were accepting and wanting to move forward.
So what we see very often in practices is that they present all the treatment, the total cost. They kind of shock people, and shock people often just, I got to think about this, And once they think about it, once they hit the door, your chances of getting them back are reduced dramatically, rather than having a little piece that okay, yeah, I can move forward with that. And then if you start on it that day, that's even another piece that keeps them in. But we see what we call one and dones, where we see a new patient, they present this big treatment plan, they never see the patient again. And in some practices that measure that, it can be 30, 40% of their new patients. And so this helps eliminate the ones and dones.
Yeah, it makes a huge difference we don't have near as many one and dones. And again, we have more patients that move forward quicker with more treatment than when we present an entire treatment plan. Now, for the viewing audience, I will say, there are a few procedures that we're going to present the whole treatment plan.
Right.
There are some things that we need to make sure we go over everything, because it really is an all or nothing.
Right.
Extractions and immediate denture, we're going to do the whole thing.
Right.
But in general, with just
severe wear cases, plain occlusion problems, or some things that you can't do. Yes, you can't do piece by piece. But that's maybe 10% of the practice.
Yes, it's very small. And what you will see with this is, back to the very first slide, is I want to make more money, is you will see your production, the office's production, the hygienist's production, the profitability, all of those things in the practice will increase, simply because patients are getting the treatment they want, need, and deserve more often than leaving without doing the work. So it's really a win-win for everybody.
And so as a management team, you can support a practice moving to that by talking about, what does an area of focus look like? Is that a geographic area in the mouth? It might even be somewhat determined by a dollar amount. Maybe you want to keep a neighborhood under a certain amount of money. I've seen practices do that as well. And that money might be different if you're in a neighborhood like you were practicing in that was a lower income area. That number might be different than if you're practicing in a more affluent area. It may not be different, but it may be. And so you can help a practice kind of zero in on that, and then follow the case acceptance rate. So what is the percentage of people that are moving forward with something? Right? That's the key number, again, highly correlated with profitability. That is how we get the best patient care, because they're moving forward with something. They're on the step to be, stable, healthy, and attractive.
Yeah, And from the management side, that's something that's very measurable, is you can really look back and see what was the case acceptance and which of those cases were focused treatment plans versus an entire treatment plan printed.